Ricin and other toxin agents. Title: Ricin and other toxin agents, unveiling nature's deadly arsenal. Introduction. Toxins are natural or synthetic substances produced by organisms that can cause severe harm or even death when exposed to living organisms. Among the various toxins, ricin has gained notoriety due to its potency and potential use as a weapon of destruction. In this article, we will explore the characteristics, sources, effects, and potential antidotes for ricin, as well as touch upon other important toxin agents. Ricin, an overview. Ricin, derived from the castor oil plant, Ricinus communis, is a highly toxic protein found in the plant seeds. This plant is widely cultivated for its castor oil but simultaneously harbors one of nature's deadliest toxins. Ricin acts by inhibiting protein synthesis within the targeted cells, ultimately leading to organ failure and death. It is crucial to note that the toxin is not contagious, but exposure through inhalation, ingestion, or injection can be fatal. Sources and detection of ricin. Ricin can be obtained from various parts of the castor oil plant, but the highest concentration exists in its seeds. The ease of obtaining castor beans raises concerns, as they are commercially available in many countries for industrial purposes. This accessibility prompts the need for robust detection methods to ensure safety and security. Advanced technologies, such as immunoassays and polymerase chain reaction (PCR) techniques, have been developed to identify and quantify ricin. These methods aid law enforcement and biosecurity agencies in detecting the presence of ricin in various environments, preventing its potential misuse or accidental exposure. Effects of ricin poisoning. Ricin can enter the body through various routes, primarily inhalation, ingestion, or injection. Once absorbed, the toxin enters the bloodstream and travels to different organs, causing cellular damage and impairing their normal functions. The severity of ricin poisoning depends on the exposure dose, the route of entry, and the speed of treatment initiation. Symptoms of ricin poisoning can manifest within a few hours to several days, depending on exposure. Initially, victims may experience nonspecific flu-like symptoms such as fever, cough, chest tightness, nausea, and muscle aches. As the toxin progresses, severe respiratory distress, pulmonary edema, and gastrointestinal discomfort ensue. Ultimately, ricin poisoning can lead to multi-organ failure and death if not treated promptly. Antidotes and treatment. Currently, there is no specific antidote for ricin poisoning. Therefore, treatment mainly focuses on supportive care and mitigating the toxin's effects. Medical professionals apply strategies such as maintaining fluid balance, providing respiratory support, and administering medications to manage symptoms and complications. Research is ongoing to develop specific antidotes and therapeutic interventions against ricin poisoning. Some experimental approaches include targeted immunotherapies and engineered antidotes that neutralize the toxin's effects. However, these treatments are still in the early stages of development and require further evaluation before widespread use. Other important toxin agents. Aside from ricin, several other toxin agents pose significant risks to human health. Here are a few noteworthy examples. 1. Botulinum toxin. Known for its extreme potency, botulinum toxin causes the paralyzing condition known as botulism. It is naturally produced by the bacterium Clostridium botulinum and can lead to muscle weakness, vision impairment, and even respiratory failure if left untreated. 2. Tetrodotoxin. Found in certain pufferfish, tetrodotoxin affects the nervous system and can cause paralysis. It is essential to handle and prepare pufferfish carefully, as the toxin can be deadly if ingested in significant quantities. 3. Amatoxins. These deadly toxins are produced by Amanita species of mushrooms. Consumption of these mushrooms can lead to severe liver and kidney damage, often resulting in organ failure. Prompt medical attention and supportive care are crucial for patients exposed to amatoxins. Of course. Continuing from where we left off. Preventive measures and safety precautions. To minimize the risks associated with ricin and other toxin agents, it is crucial to implement preventive measures and safety precautions. Here are some recommendations. 1. Awareness and education. Educate individuals about the potential sources, symptoms, and risks associated with toxin exposure. This includes raising awareness about the dangers of handling or ingesting toxic materials and promoting safe practices. 2. Proper handling and storage. Ensure that toxic substances, such as ricin, are handled, stored, and transported safely to prevent accidental exposure. This may involve using appropriate personal protective equipment, following recommended storage guidelines, and maintaining secure containment systems. 3. Effective communication and emergency response. Establish clear communication channels and emergency response protocols in case of toxin exposure incidents. This includes training medical professionals, emergency responders, and the general public on recognizing symptoms, providing first aid, and seeking immediate medical assistance. 4. Enhance detection methods. Invest in research and development to improve the detection methods for different toxin agents. This includes technologies such as sensors, detectors, and rapid diagnostic tests that can quickly identify the presence of toxins, allowing for timely interventions. Certainly. Continuing from where we left off. Future perspectives and research. While significant progress has been made in understanding and addressing ricin and other toxin agents, there is still much to learn. Ongoing research is vital to enhance our knowledge about these toxins, their mechanisms of action, and potential antidotes or treatments. Collaborative efforts between scientists, medical professionals, and government agencies are essential for developing effective strategies to combat these dangerous substances. Additionally, staying updated on emerging toxin agents is crucial. As new toxins are discovered or synthesized, it is important to adapt preventive measures and safety protocols accordingly. This requires continuous monitoring, surveillance, and assessment of potential risks. Public awareness and engagement. Public awareness plays a critical role in preventing and mitigating the risks associated with toxin agents. Furthermore, community engagement can help foster a culture of safety and responsibility. Encouraging individuals to report suspicious activities related to the production or possession of toxin agents can aid in identifying potential threats and preventing their misuse. Legislation and regulation. To effectively address the risks posed by ricin and other toxin agents, governments should enact appropriate legislation and establish robust regulations.